Okay. Everybody heard of teeth in a day? Everybody think that that can't be possible? Teeth in a day has been around for quite a while, actually. It was developed over in Europe, and I think I'd been doing implants for at least 10 years or more when it first came out, and I was very skeptical too. But as the studies came out, it found that the success rate is just as high, and actually in some cases, teeth in a day is actually more successful than doing it the old way of putting them in and letting them away. So we'll talk about teeth in a day. The reason teeth in a day works is because they're all connected together. And you can't do teeth in a day on just one or two teeth. And even that's not entirely true. We can do that sometimes. But teeth in a day works very well because also the surgical planning that we have available, we know where your dense bone is and we know where the best bone is. So we can put the implants in the most secure, ideal location, and then we link them all together and they're strong enough. So it works very well. Now, it's also temporary teeth in a day. So there are some places that do teeth in a day, and these are some of the kind of less cost places that you'll see advertised and stuff. And what their teeth in a day is plastic teeth in a day. And that's your teeth, and you're done. And that's great for some people. But for most people that are going to be around for a while, when I mean be around, I mean your lifespan. If you're 85 and you decided you were 90 and you decided, and I've had patients in their late 90s have implant treatment. Maybe you don't need something that's more durable. But the reality is people are living longer and they're being more active, and plastic doesn't hold up. So teeth in a day is always temporary acrylic teeth in a day. And then what we do is after 3 to 4 months of healing, then you get your real teeth. You're never without teeth, but those are your temporary healing teeth. And you can eat right away. They look and function and everything looks great, but you are on a soft diet. I mean, it's just like having a broken bone. You can't go and run on that broken leg. You have to give the bone time to heal. So the temporary teeth in a day are acrylic. They look and feel good, but they're not as strong as the finals will be. And you are restricted to a softer diet. So no, you don't have to eat oatmeal for 3 or 4 months, but you can't eat anything that you can't break up with a fork. So if you can take your fork and you can break it up, so that means fish, chicken, ground beef, it means you can't eat a steak. So things like that, but only for 3 or 4 months. So, but yeah, teeth in a day does work very well. It doesn't work for everybody. You have to have enough bone and you have to have strong enough bone. But these days, with all the 3D planning and the CT scans, we can be very sure of what we're doing before we go into the surgery. So that's teeth in a day. And once again, these are some of the things that help us plan it. We know exactly where your teeth are going to go. We know exactly where your implants are going to go. And we know if it's going to be strong enough to do teeth in a day. So these are some of the things that have changed dramatically over the last 5 years in dentistry. Okay, so it is teeth in a day, but you don't just walk in. It's not just visit, but very often it's as few as 2. The first appointment is for measurements, molds of your teeth. We talk about what you want them to look like, things like that. And the second appointment is when you get them. And here's a view. We don't like to show too many surgical pictures, but people very often say, oh, well, isn't that terrible to have the teeth right the day of the surgery? Well, the other way of doing it is all your teeth come out and you get a denture that fits right up under all the extraction area. So you've got this big wound in your mouth and your denture is sitting right on that. And believe me, that's uncomfortable. Having teeth in a day, there's a little bit of a gap there. So when this person bites down, even the night of the surgery, there's no pressure on their gums at all. All the pressure's on the bone, and the bone has no feeling. So even though there's stitches and healing going on underneath there, there's no pressure on there at all. So it's a far more comfortable way of doing it.